Now, the nurses' strike continues to bite across the country as it entered its second day, leaving a trail of suffering in its wake. Patients at Embu Level 5, Kericho and Bungoma referral hospitals have been forced to abandon treatment and return home after services were paralyzed. The nurses insist the Council of Governors, the Salaries and Remuneration Commission, and the Ministry of Health remain the biggest stumbling blocks to implementing the 2017 collective bargaining agreement. NTV's Electine Odera reports on the unfolding crisis in counties hardest hit by the strike.
At Embu Level 5 Hospital, the situation has turned dire as patients surrender and head back home, unable to afford treatment at private facilities.
Sasa tutarudi nyumbani sisi juu hatuna hata pesa ya kuenda private.
Tukiomba serikali turudishie madaktari wengine kama wameshindwa.
Confusion grips patients and their families as empty beds tell the story of a health system at a standstill.
There's no treatment going on in the hospitals.
The situation is not different in Kericho, just days after health workers suspended a strike following a deal with the county government.
Hakuna kitu hapa. Watu wanaumia, nimechoma pesa yangu kutoka mali nimetoka sub county kuja hapa tukutibiwa. Na hii ni siku ya 3 sasa. Mara naambiwa watu wengine wamelipwa, sijui wengine hawajalipwa. Sasa kulipwa kwa maaguzi madaktari ni shida yetu.
Nurses insist the government must honor their CBA and return to work formula. In Machakos, they accuse the Council of Governors of being their biggest obstacle.
We are finding that already the county government of Machakos, for example, sets a budget. They want to implement this CBA. But then their hands are tied as the individual to employers, now the county government. And a very good example is the risk allowance, which Our Excellence here set the budget for it. But then implementing it in the payroll of these nurses becomes a challenge because COG becomes an entrance.
In Bungoma, nurses openly tell patients they have walked out of public hospitals.
Ninasema kila hospitali upande wa Bungoma ifungwe kwa sababu paka lazima malilio yote ifanye nini isikike.
A nurse is the only healthcare worker who spends 24 hours with a patient. But unfortunately, the risk allowance that is in our payslip is wanting, is peanuts, is our silvers.
In Muranga, interns and community health workers are left to handle long queues of patients, which is similar to Makueni County Referral Hospital.
Lakini huku hatuoni mgomo wa madaktari, chakula hiko, madawa hiko.
So we are asking that the matter be resolved centrally very fast, and if not, Makueni can actually handle theirs because we have been sitting down with the unions.
In Kisii, nurses staged protests over the failure to reinstate 46 colleagues who were dismissed, with the Council of Governors blamed. The strike has also paralyzed services in Turkana, leaving residents frustrated that some counties remain unaffected. Residents are angered that the strike has spared some counties.
Kwani gavana wengine wanapeangwa pesa na serikali na wengine hawapeangwi njuu huku Embu hakuna kwa sapande ya mahospitali ni kumbaya sana.
The nurses have vowed not to return to work until the Council of Governors listens, SRC increases their pay, and UHC colleagues are given permanent contracts. For them, this is now a national struggle.
Solidarity forever.
Electine Odera, NTV.